Sissy here again. Today this video is going to be about how to stretch out the calf muscles, and this is on special request from a viewer, Melissa. So shout out to Melissa, thanks for the question. What most of us don't know about the calf muscles is that we actually have two main calf muscles. So there's slightly different ways that we can stretch one over the other. Obviously, you can see here the calf muscle is this part of our leg. This muscle is actually made up of, as I said, two parts. The first one is the gastroc muscle, which is that really big one that most of us think at. It's that really big fleshy one. And underneath it we have another calf muscle that is called the soleus muscle. Now both of those muscles feed into the Achilles tendon, which is the back of the ankle and foot, just in through here. But where they attach up around the knee is quite different, and that's what determines how we should actually stretch it. The gastroc muscle, so the big one, actually has two parts to it, comes in and attaches above the knee. The soleus muscle, in comparison, attaches below the knee. So what that means is that the position of our knee determines whether or not we're stretching one over the other. So for both, because they have that common insertion into that Achilles tendon, we need to make sure we're going into what we call dorsiflexion. So you need the toes bent up towards you, or from side on, it looks like this. So you want to have a smaller angle at the ankle to make sure you're stretching the calf muscle properly. If we wanted to stretch the gastroc muscle, so that's the one that attaches above the knee, we need to make sure that the knee's straight. So this is one that you might see a lot of runners doing before they go out for a jog, stretching the gastrocnemius muscle more so than the soleus muscle, because the knee is straight and that ankle is bent. This leg here is actually more of a stretch for the soleus muscle. So as you can see, the ankle is bent, but the knee is bent. So remembering it attaches underneath the knee. So to stretch it, you actually don't need to worry so much about having that knee straight. Both of these stretches can be really good, particularly after a run. I don't usually recommend sustained stretches before doing a run or doing any sort of plyometric or maximal type exercise, just because prolonged stretching can actually reduce the ability of that muscle to fire. So you're doing 3 sets of 30 seconds, that's been shown to be quite effective, but generally after you've done exercise, when you've warmed up a little bit, if you want to try and loosen off or reduce tightness in those muscles, using a TheraBand, you can use a string or a rope or whatever you have at home, can actually also be quite effective. Some people prefer doing a stretch in sitting down like this, and you can then use that band to pull the toes towards you. Oops. Obviously holding the band better than I am, and getting one that's not broken would actually work well too. But this band just helps to pull the toes towards you, so you're getting more of that stretch along that gastrocnemius muscle. I actually really like a active mobilization to release the calf muscle. I find that they're more effective than just long sustained holds. You can do this with either a roll. So if you have had this roll for some of the other exercises I've shown, it can be handy for lots of other things, including a good calf mobilization, or a tennis ball if you're feeling a little bit more torturous or sadistic, can be really quite effective too. So an easy way to do this, you simply place the calf or the leg that you want to mobilize. So say it's my right leg that I find my right calf is a little bit tight and I want to mobilize it. You simply place that fleshy part of your calf onto the roll. Some people might already feel, just with that pressure, that weight of the leg weighing down on the roll, that it's a little bit sore. And that can be a good enough mobilization for some people if they're very, very tight in those muscles. You can obviously just roll up and down, which I think a lot of us already do instinctively. But here's where the active part of the mobilization comes in, and that's where we actually bring the toes towards us and point the toes away. So what you're actually doing there is actually using the calf muscle which you're trying to mobilize to help with that mobilization. And as you're lengthening and shortening that muscle, that actually helps you to get a bit more of an effective mobilization Now you can do this wherever you feel tight, so I often try and change the angle of the leg or up and down the calf depending on where you find those points that are a little bit sore. But yes, I find this active movement component of the mobilisation just tends to be a little bit more effective when you're mobilising these muscles. I'll show you now with the tennis ball, so exactly the same thing. You simply place it underneath the calf. I'll do my left one just to even myself out a little bit. So with that ball, you can see you can just roll yourself around like that. I can find lots of little tight points already actually. Or again, you can bring in that active component where you're shortening and lengthening that muscle as you're placing the weight of the leg on that ball. And that can be, I can feel the difference already, really, really effective just in getting those trigger points and releasing those trigger points that we often get in the calf muscle, particularly if we do run or do any kind of lower leg activity. So there's some really easy tricks for how to stretch or release the calf muscle, remembering there are those two, so the angle of the knee can affect whether you're stretching one more than the other. If you have any questions, just pop them in the comments or send me a message, and if you can subscribe and share this video with your friends or anyone else that might benefit from it, that'd be really great. Until next time.